This is a short video to talk about why sometimes we do a root canal treatment on the tooth and sometimes we just go ahead and take the tooth out. First of all, not every tooth will qualify for root canal treatment. In some cases, the tooth is already far gone in terms of damage to the tooth, in terms of the level of infection and so on, and it's actually better to just take the tooth out. Root canal treatment in itself is not always 100%. So you can have root canal treatment on a tooth, but the outcome of the tooth is always not 100%, and you may eventually lose the tooth. So based on your examination, clinical examination and symptoms and everything, your dentist will put all the information together and make an assessment and see if root canal treatment is the best option. If not, it's probably better to have the tooth taken out. Other reasons why root canal treatment may not be ideal is that for some cases, it tends to be a bit more expensive. It tends to be expensive, and for some patients, the cost can put them off, and it's better to just have the tooth taken out. In some cases, the tooth is weakened beyond repair, and root canal treatment ends up being a waste of time and a waste of money, and it's better to have the tooth extracted. Some patients just prefer taking out instead of going through all the process of root canal treatment. Root canal treatment is also sometimes a long procedure, so you may visit the dentist a couple of times, be in the chair for a long period of time, and some patients just don't like to go through all that. So in those cases, it's probably better to just take the tooth out. There are reasons why we try to save the tooth rather than take the tooth out. We try to save the tooth with root canal treatment because once you have the tooth in there, it kind of preserves your bone. So instead of losing that tooth, because once you lose the tooth, the bone begins to collapse, and it's better to keep the tooth in position in some cases. So that is why we try to save it with root canal treatment. And also, if the tooth is in the smile zone, you want to keep it in as long as possible. So instead of just taking the tooth out, we try to save it with root canal treatment. So putting everything together, there's no one reason why someone may go for root canal treatment or extraction, but we put all the information together and see which direction will be better for a patient. In any case, if the tooth is extracted, it's not the end of the world. After extraction, there are ways that the tooth can be replaced. You can have a denture, a removable denture. You can